trust is pretty much.
And that's totally true of everyone, but that's especially true of a teenager, right? Of everybody. Yeah, very, very few people are going to come into counseling the first time you meet them and say everything. In fact, there's a theory that says sometimes if people do say too much, they'll be embarrassed to come back. Right? Afterwards they realized, oh, past that boundary, or I disclosed too much, or that was too embarrassing. Can't believe I told that person that, right? So sometimes when people have something, and this is true with kids, if they feel something about a parent or if it's a divorce issue, it's oftentimes better if they wait a couple times and kind of get to know you, and then they'll say, oh yeah, that feels like my dad too. Oh, really? Yeah.
Okay. How do you, when they first come in, how do you start a conversation? Just
about typical things first. Almost all kids have some things that are, I don't know, common, right? School, what's the best about school? I know the answer is going to be recess. Right? So what do you like? What's your teacher like? What are your friends like? Knowing how kids make friends and how they keep friends is really important. So if they have some kind of family structure and a friendship structure, that kid's going to be a lot more resilient than kids who can't make friends or are socially awkward, don't talk to people. Yeah.
Is there other stuff you learn in the first couple times, like hidden questions and answers that tells you more about the kid and what you're trying to approach?
Hidden things, meaning things they don't say right away?
Or sort of like what you're just talking about, where hidden towards, they don't know what they're telling you, but you know that the way that they are making friends is a big deal about what you're about to talk about.
Okay. Well, with kids, there's certain developmental, have you done some kind of lifespan yet where you learn about different developmental stages?
We did a little bit with infants and children.
Okay. So there's certain milestones that it doesn't mean anything to the kid, whether they met a milestone or not, but the parent will know. And yes, unfortunately, that does tell us things, right? So it could even be, it's your typical, do they sleep through the night? At a certain age, do they sleep in their own bed? Do they feed themselves? Will they eat a variety of food? Do they take care of their toileting needs themselves? So, and then you start with social things, making friends, being able to interact with other kids. Yeah, doesn't mean anything to the kid. Yeah.
Okay.
When you see little kids, and nowadays a lot of kids have all kind of developmental issues going on, and that affects their behavior. How do you approach it if a child might have like ADHD and they're portraying certain behaviors, and you're trying to ask them questions and in a way that they'll understand and be able to confide in you? How do you approach a child like that?
Well, interesting that you brought up ADHD, isn't it? Or ADD. So, a couple things there. So the diagnosis would be ADD, either with hyperactivity, with lack of concentration, so focus issues, or a combined type. If someone was hyperactive in the office, it makes it a little difficult, right? But we could be standing up, we could be bouncing a ball, we could be doing something while talking is happening, or playing something. I don't have Legos in this office, but most young people love the Legos. And so instead of being like this, which might be a little bit uncomfortable, or would definitely be uncomfortable, we could be just not literally side by side, but we could be digging in the same Lego box, doing things. Do you need this? Talking. And a child like that might be more apt to open up and really just talk about things. And again, not really realizing that it's any significance, but just talking about their life, what happens. Yeah. sitting down like this, we would never
Yeah,
do with
not
kids.
ever.
So do you more or less you just listen, or do you like for all of these just the main topic we've been talking about? Is it better for the kid just to talk about it, or do you put input?
I'd like to think of, I do cognitive behavioral therapy mostly, so I like to think of it as a combination of things. So perhaps I would offer solutions, like problem solving, and most kids, even as young as like kindergarten, have learned some kind of problem solving skills.
Mm-hmm.
And they could come up with ideas, and it doesn't matter that they would never work, but the idea that they would be willing to say maybe this, maybe that, kind of makes them a little more industrious, right? Instead of being like, I don't know, nothing's gonna work, nothing's ever gonna change, right? You don't want them stuck in that kind of Eeyore mentality. So if they're throwing out any ideas, good thinking, good idea, you're a good thinker, to get them to the idea. But ultimately, the kid, I like it when kids make their own charts instead of the parent or somebody else doing it for them. So they're kind of committing to their own changes that need to be made, right?
Okay, what do you mean by charts? Do you have?
Oh, well, like if you were going to do one, I would just say, what are some things that you do every day? And typically, you would say, things I do or things I'm supposed to do. And I'll say, let's work on both. What do you want to put down first? So you write down some obvious things, and then you say, I'm supposed to do this, right?
Yeah.
But I don't want to. We're going to talk about that a little bit, why not? And then I say, how many days a week do you need to do that? And let's say in your case, you're like, drive to class. How many days? Do that, right? So we say, okay, that's, if you do it 3 days a week, that's 3 points. 5 days a week, whatever. Add up the points and help typically the parent say, work on some kind of reward system for coming within range. So we never say, if like say you made yourself a little chart, you totaled it up and you said, this week is 30 points. So for the month, I've got 120 points I can earn. You don't ever say, you make 120 points or you're nothing, right? You
Yeah.
say, what's 80% of that? Kids will go, I don't know. They'll look at their parent and they'll look at the other kids going, what's 80%? And so if you work backwards, what's 10%? So you're still helping them problem solve. What's 10%? 12. What's 20%? 24. Okay. So they'll go, let's see, it was 120, so 180 something. I'm like, close enough. So that's the goal. Do you know what I mean?
Mm-hmm.
And at the same time, the parents in the room, the parents are going, why haven't I thought of this?
Yeah.
Right? Because when kids get to a point where they've blown it once, and it doesn't matter if they blow it again, because they can't get what they earned,
Mm-hmm.
the whole thing's out the window.
Okay.
Right?
Yeah.
So always set kids up for success. Make sure they can do it. In fact, if your list was too hard, I might say, wow, that's some big goals you got there. What are you doing now that you know you could do? And you might say, well, I know I can get up and shower and brush my teeth every morning. I'm not going to write that. I might be like, oh, write it down. Just so mom could see it or something. You know what I mean?
Set up the
Yeah.
mini goals to make up that one big goal, so the
Yeah,
overall picture is like
Yeah.
you have succeeded.
exactly. Yeah. So just set them up so you know they're going to succeed. Yeah. Yeah. Did that answer your question? I feel like I went off on a tangent when
I think it did.
I said the word chart. Sorry.
Yeah, it did. You're talking about. I don't remember now.
Okay.
But yeah, I did. I'm pretty sure.
Okay.
So when you deal with them, you kind of make them think about it, make them come up with the problems, or.
That's what we're talking about, problem solving. Yes. Because everyone can problem solve, and that's a life skill that everybody needs to know.
Mm-hmm.
Yeah. Not everyone lives in an environment where that's safe. Sometimes there's name calling or, that's the stupidest idea I ever heard or,
Mm-hmm.
and kids don't feel like it's safe. So if they have a safe place, they usually will do that, to just throw out different ideas. And then they're pretty good at knowing what would work and what wouldn't work. Like they can't get a new puppy every week, right?
Yeah.
Like they might get a 99-cent ice cream at McDonald's for a week's worth, but not, you know what I mean?
Yeah.
Or,
Something like that. Okay.
yeah,
So, is that how you approach most things then that you deal with?
yes.
You approach it. So, when everyone comes in with all the different problems, everything's different. You approach them by getting them to problem solve and figure out what they should do with what's going on.
Mm-hmm.
Okay. How about with different social skills? Like, how do kids respond? Like, a really talkative or a really shy or hyper. Do they respond differently? We talked about it a little bit, but.
They do, but here's the thing. More words, someone being more talkative, doesn't necessarily mean they'll get to the point quicker. Sometimes kids are just thinkers, and they'll work with Play-Doh, or sometimes teenagers will doodle just different colors. It'll be this elaborate something, and you'll think you're talking about nothing, and then all of a sudden